Valentine's Day last year, my life changed. Everything changed. A few weeks before, I knew something was different. I was short of breath. I was 45, maybe I was getting old. I needed to work out a little harder. I spent more time in the gym. But that wasn't it. As I developed a rash, my gums were sore. As a physician, I knew something was wrong. But I was invincible. I'd never seen a primary care doctor. I didn't have a physician. I convinced a friend and a colleague to draw a CBC. Didn't even ask him to check it over the next few days. It was Monday before Valentine's Day when I looked at my chart, looked at my labs, knew that abnormal, there was very few things. Knew I had leukemia. It couldn't be anything else. Went home that night. My wife, like any good infectious disease physician, over a glass of wine, tried to convince me it had to be mono. It had to be something infectious. We both knew it wasn't. We went to work the next day. A few more hours of acting like everything was normal. A mentor, a colleague, a friend, Dr. Deal for 2 decades, walked into our room on Valentine's Day. The door hadn't closed when he directly said, "Dave, I hate to tell you, you have AML." He picked up a piece of paper. He drew out a treatment plan. He described treatment that hadn't changed in decades. I listened a little, but all I could really think about was 2 boys. How do you think of your children and what it means to them? How am I going to go home tonight? He gave me one more night at home. I knew that I would be admitted the next day. I would spend at least the next 30 days in the hospital. We drove home. There was only one thing we discussed. What and when do we tell the children? We knew we couldn't tell them that night. It was our secret for one more night. Our 13-year-old 7th grader was going to Washington, D.C. the next morning. I wanted him to be a normal middle schooler one more day. His life wasn't going to be normal for a long time. How would he handle the illness of his father and the potential loss of his father? We kept our secret that night. I think it's the earliest we've gotten the kids to bed in years. Homework, go right to bed, get some sleep. I remember going to put him to bed that night. Thankfully, it was dark. The tears in my eyes, they didn't notice as I was keeping my secret so they could have that normal day. They went to sleep. We went downstairs. I always thought I would have approached illness as a physician so differently. I didn't want to be a physician. I remember looking at Amy saying, "I need you to help me figure out what's right." I couldn't read and still haven't read the literature. I haven't thought about the pathophysiology. I sat there and wondered, was I going to come home again? I sat there and wondered, would my kids grow up without a father? How would Amy be as a single mom? She doesn't even know how to use online banking. You know, we unintentionally, but in hindsight, we all moved into roles. She pulled up the computer and was on the laptop. My mind continued to play the script over and over, no matter how many times I tried to push it away, of what will happen to the kids. I remember going to bed that night, the first of a lot of nights over the next few months, where you have that script that you so much want to stop playing and you can't because it keeps playing in your head of what will happen to your children. The next morning, we took them to school, kept our secret, didn't let them know what was happening. Our 7th grader would go to DC, the 5th grader would go to school, and we would go to Duke Hospital where I'd be admitted to 9100 for at least the next 30 days. I wouldn't put them to bed for at least the next 30 days, and that was the best I could hope for. That afternoon, I had no idea what to say when our 11-year-old Jonah came to the hospital. I'm not even sure what I said. I remember when Amy picked him up and he asked, "Why am I going to Duke Hospital?" And she said, "You'll find out." He showed up on the 9th floor. He probably hadn't seen me cry, but it was very little to say except for the tears. I remember explaining to him that I had leukemia. Didn't realize that an 11-year-old doesn't know what leukemia is. I needed to explain to him that Dad had cancer, that we were going to beat this, but that some people die. I was amazed he had so few questions. He was strong. For weeks and months, I actually didn't think he understood mortality and cancer. I wasn't sure that an 11-year-old really understood what was happening. It's only now, as I've read his poems and his writings in school, that I realized he knew all along everything that was happening. But he had a faith in me that Dad could beat anything, and Dad was gonna win no matter what. And that faith transcended everything where he had strength, because he didn't consider me losing as an option. I remember as he got ready to leave that day, we were telling stories. I used to do a lot of lung transplant work, and I told him a story that the nurses used to always laugh at me, that I was known for making patients walk 100 laps a day and believe that patients that were the strongest always did the best. Within a few minutes, I was doing laps around the 9th floor. I had my exercise partner that would continue for months of inpatient stays and bone marrow transplant, that every day I spoke, "Dad, how much did you walk today?" I couldn't disappoint him. I had to live up to his expectations that I would win and I would be strong enough. And to him, that exercise was what we could do to make a difference. As he left that night, that was my first night in the hospital. I don't think I ever realized in 20 years of being a physician how lonely nights are in the hospital. Times when your mind races and thinks of things you don't want to think about. That night he left, at least I was able to think about his strength and realize that I needed to do this for him and to not disappoint him. He asked when he left, "Can I tell my friends?" A story about 5th graders and social media. I don't realize when you tell your friends it's not picking up a phone. Remember, our 7th grader still doesn't know that Dad has cancer. He puts out to all 100 students on the Durham Academy 5th grade group chat, "My dad has cancer." The phone starts ringing off the hook of now realizing that not only all of Duke Health System, but all of Durham Academy is aware of our family's challenges. And we are hoping and praying that our 7th year grader doesn't find out through friends and others that Dad has cancer. Thankfully, technology-free trips really are technology-free, and no one brought a cell phone. Fast forward 2 days later, we've left Duke, we've moved to Hopkins to enroll in a clinical trial. When you're facing a poor prognosis, looking at your own potential death, you're grasping at straws of what can I do? The 7th grade trip to Washington, D.C. is over. Thankful to a friend of ours who picks him up in D.C. and rather than bringing him back to Raleigh, brings him to Baltimore. He's so tired, he has no idea where he's going and doesn't realize he's not even heading back to Raleigh. He shows up at Hopkins and sees Amy crying in the doorway. She had to tell him. She had to let him know that I had cancer because I was getting a procedure and had to explain to him why I was here at a hospital. I remember when he walked in the room, we said very little, even more than our younger child. The fear was visible in his face. The fear that Dad was going to die was there. We cried a lot. We fit in a recliner that barely fit me, much less two of us together. And we talked, but I only remember one question. He asked, "What are the odds that you're going to survive?" I knew what the odds were, but they didn't matter. I explained to him as a patient, I was going to live or I was going to die. I would win or lose. Odds didn't matter. There was only one or the other. That I was convinced that we would find a way to win. He bought my explanation. He never asked again in the next 6 months. He didn't realize that he'd get to play a lead role in this story. As a 13-year-old, he got to become one of few teenagers that can say, I saved my dad's life. He got to be the bone marrow donor. He was scared to death of a flu shot, much less a blood draw and a needle. He got countless numbers of blood draws, going to the operating room for bone marrow harvests and recoveries and blood donations, and did it without a tear. He reminds me frequently, especially when he acts like a teenager, that, Dad, remember, I saved your life. But it's true. When I look back over the last year, weeks of chemotherapy, months in the hospital, a bone marrow transplant, I was fortunate. They were physically easier than I could have imagined. Mentally and emotionally, the last year has been so different than I would have ever expected. I still haven't read anything around AML. I know my prognosis wasn't good. I'm dependent on a phase 1 trial in clinical research. But leukemia has given me a gift and given my family a gift. My kids have matured more than their friends. They've had to face the potential loss of their father. Our family has grown closer. I'm thankful that I'm not only alive, as Amy occasionally reminds me, but that I'm thriving. My only hope is how out of this experience that I will be a better father, a better husband, better physician, a better leader, and add more value because of what leukemia has given us. Thank you.
That's David Zaas.